Inside of this rural Arizona inpatient unit, healthcare workers are exhausted, working 12-hour shifts with no end in sight, treating COVID-19 patients. Dressed in full PPE with a small team of no more than about 6 at a time, the inpatient unit has had to switch gears quickly.
We've become a miniature ICU here with patients on heated high-flow oxygen. Sometimes we have to intubate them.
Dawn Goad, the med-surg telemanager of the inpatient unit, says at the beginning of the pandemic, this wasn't the case. COVID-19 patients didn't begin filling their 14 beds until the summer.
Typically, our nurses have 2 to 3 patients apiece, and here recently they have anywhere from 5 to 7 patients apiece.
When I was in the 14-bed inpatient unit, more than half of the patients were battling COVID-19. But inside the emergency rooms in both Bisbee and Douglas, there was an average of 46 COVID patients per day in December, and even more in November at 55 per day. Behind one of those numbers is Frank. He spent more than 2 weeks inside the inpatient unit.
I wouldn't wish this on nobody. And I consider myself lucky that they just have me on oxygen.
Frank drove 40 minutes for care from Douglas and has only seen his family through his hospital window. It's a similar story for many other patients who make the drive from St. David or other areas in Cochise County.
They end up getting a lot worse, and then we have to ship them out instead of being able to take care of them more quickly when they're first sick.
And she says those are the hardest days, shipping patients out using the surge line, knowing they won't be able to see their families for a while.
Sometimes we've had patients either in the emergency room or here on our floor for hours to a day before they're able to get to a facility because either the beds are full or we don't have the transportation to get them where they need to go.
She says patients have gone as far as Kingman and Sun City, more than 5 hours away, because they can't get into Tucson hospitals. And they have numbers for hospitals out of state, just in case they need to use them.
The other thing is that the surge line now does for us that we didn't have before is if a patient has been transferred to a facility such as Sun City, they will now provide transportation for that patient to come back to home.
That means at times those patients would have to drive more than 300 miles back to southern Arizona. And while the nurses in Bisbee are doing the best they can with the limited resources they have to treat their small but tight-knit border community, they're finding themselves falling to COVID as well.
They're exhausted. They don't get to take a lot of drink breaks, and so they tend to get dehydrated. So it's very difficult, and it lowers their immune system.
Nonetheless, the Copper Queen team is not giving up as they eye another surge. The state is sending some extra hands to help out here at the Bisbee Hospital. Sierra Encinas, KGUN 9 on your side.